Bismillahirrahmanirrahim. Welcome to Medical Club e-learning. This is Musdalim from Shaita Medical College. Today's our topic is minerals. First of all, see its source. Here are 4 MCQs and 0.5 mean half SEQ from this section. Starting our chapter, you should know about the classification. It is important for SEQs and MCQs. On this page, this blue table is very important for UQ. You should know about all the elements, their functions, their dietary allowances, and their sources. First of all, our mineral is calcium. You should know the biochemical functions, disease states, and their daily requirements of all the minerals. That is important for SEQs and MCQs. Now, first SEQ is biochemical function of calcium. All these underlined with green. This one, and absorption, that is the factors promoting calcium absorption and factors inhibiting calcium absorption are important for SEQs. On the next page, this figure is important to see the factors affecting calcium absorption and inhibition. Regulation of plasma calcium levels is also important for SEQ. On the next page, here are some diseases of calcium deficiency, and this one, hypercalcemia, hypocalcemia, liquids all related to calcium levels. All these are important for SEQs. Osteoporosis is also important for MCQ and SEQ. This one. Next one is phosphorus. You should know about its daily requirement and biochemical function of phosphorus that are important for SEQ. On the next page, here are some disease states of phosphorus. This one is not much important, but you can read it. Magnesium. Also, the biochemical function of magnesium is important for SEQ, its dietary requirement, and disease states. Here is sodium. Its biochemical functions are very important. Its dietary requirements are also very important, and sources of calcium is also important for MCQ. Then you should know about its disease states that are very important for SEQ and UQ. Hyponatremia, hypernatremia, edema all are very important. This one is potassium. Potassium biochemical functions is also important for SEQ. Its dietary requirement is important for MCQ. Then you should know about its plasma concentration, and disease states is also very important for SEQ, that is hypokalemia, hyperkalemia. Next one is chlorine. Its biochemical function is also important for SEQ. Its dietary requirement is important for MCQ. And disease states, hypochloremia and hyperchloremia is important for SEQ and MCQ. Next one is sulfur. Same, its biochemical function is important for SEQ. Iron, it is the most important, and its biochemical function is also very important for SEQ and UQ point of view. Its sources, its daily requirement, and its absorption is very important, UQ, and the factors affecting iron absorption is also very important. This figure is very important to draw and label in Prof. Next is the disease states of iron, that is anemia and hemosiderosis, hemochromatosis is important for UQ point of view. Copper, copper biochemical function is also important, but it may not ask in Prof, and it may come in MCQs. Its dietary requirements, its absorption, and its disease state is very important for UQ and SEQs, that is Menkes disease, Wilson disease. They are very important. Iodine is also very important macroelement. Its biochemical function, dietary requirements, its sources are important for MCQ, and its plasma iodine concentration. Magnesium is is not very much important. You can read it only for MCQ's point of view. Next one is zinc. Zinc is important. Its biochemical function is important for SCQ. Its dietary requirements and resources, serum level, all are important for MCQ. Next one is molybdenum is important for MCQ, not for SCQ. You can read it. Cobalt, same, is not important for SCQ, only for MCQ. Fluorine is important for SCQ. Its biochemical function is very important. And disease states like fluorosis is very important UQ and SCQ. Selenium is also an important element. Its biochemical function is very important. All these green underlines. Disease state of selenium, that one, Kishan disease, is also very important for UQ point of view. Chromium is not very important, but it may ask for MCQ. Our chapter is end. Hope so you can understand. For better preparation of Prof, you can avail services from Medical Globe Book MBBS Cracks. Thank you. Allah Hafiz.
Medical Globe introduces its series of successful publications, MBBS Cracks, the benchmark of all, containing all the chapter-wise questions of prime importance, all annual and supply solved university questions, questions to ace your vivas, chapter polls, and of course, we have incorporated all the labeled and histologic and anatomic models in high resolution for your distinction level OSCE preparations. Medical Globe has also launched a gem in the medical world to master every concept for your multiple choice questions, the MCQ cracks, encompassing UHS, NAMS, and many others, revealing the UHS MCQ rank, your practice MCQs, and topic-wise MCQs. Get your MCQ and the MBBS cracks at your doorstep by placing your order at 0335 66 33007.